Hey, my name is Milette Silar, and I'm a culinary dietitian, and I practice with this gal right here out of the University of Texas at Southwestern in the state of Texas, Dallas-Fort Worth area.
I'm Jaclyn Albin. I am a pediatrician, an internist, a recovering primary care physician, and an all-in culinary and lifestyle medicine enthusiast who does education, research, and patient care innovation at UT Southwestern in Dallas, Texas. Culinary medicine first was personal for me because my husband was diagnosed with celiac disease and my mom was diagnosed with breast cancer 2 months apart from one another while I was a resident. And I was training in internal medicine and pediatrics, and I had no idea how to help. And I found culinary medicine because I needed to know how to feed my own ill family members, and medicine didn't teach me that. So it means freedom from being afraid of what to eat when someone's sick. It means that I have empowered my children to know how to nourish their bodies for their whole life course because I found this when they were little. And it means that it's never too late for us to learn new things that we're missing. Even as highly educated people, we never have all the answers. There's always more.
Culinary medicine. When I think of culinary medicine, I think of the foundations of my dietetics program. I love the idea that dietitians can be a part of figuring out the how. We're so well trained, as most clinicians are, in what do we need to do? Why is it important? Why is this important to our health when we're talking about lifestyle intervention? But culinary medicine, as part of my training, was stepping into the kitchen and celebrating the power of what happens in any kitchen, but figuring out what a teaching kitchen is, how that all intersects with health and medicine to empower people to make change is incredibly hopeful.
And then it goes beyond the personal. It's our entire job to do this. We made it that way because we're obsessed with it. As an educator, culinary medicine means I give a skill set to a wide variety of professionals who learn not just how to cook together, not just the science behind the food that drives health or disease, but they learn how to collaborate. They learn how to function on teams. So we have medical students, we have residents, we have fellows, we have PA students, we have pharmacists, we have people across every health profession, nursing research colleagues that want to be in the kitchen, learning alongside people that they might not cross paths with otherwise, or even bother to get to know. But there's this gathering that occurs in an educational context that is hard to measure the power of. It's magic.
Yeah.
And we invite everyone to the kitchen. They don't get it till they come. In fact, the people who ask us the same questions over and over again about what exactly is it that you do, they've never shown up. You have to show up in the kitchen to see the magic of culinary medicine.
One culinary medicine session in a teaching kitchen equals 10 Zooms.
And then as scientists, we are studying how this affects people. And it's not just that we're always taking people to the kitchen, it's that we're talking about food instead of nutrients. Mm-hmm. It's that we're talking about access to not just the food pantry, but to a pot and a knife. Do our patients have access to that? We're studying that in low-income communities. So some of our research projects right now are looking at, can we use medical tailoring of food pantry groceries to drive changes in diabetes outcomes, where we have a sustainable resource in the food pantry. We're pairing it with recipes that go with seasonal food that the food pantry has access to. Does that empower people who are low income to be able to change the trajectory of their health? And then we don't always have the resources for food. We're actually partnering with pharmacists to distribute nutrition education, food pantry access, benefits like SNAP, sign up through QR code handouts at prescriptions. When they pick up their prescriptions every month, they see that more than they see their doctor. And so there's so many ways to apply culinary medicine principles at every space and place in the healthcare system. And it's really about what you said earlier, patient empowerment.
We need everybody. We need everybody on this boat. And the need is a tsunami. So yes, please get out there.
I didn't quit medicine, which I joke but not joke that I was close to opening a flower, book, coffee, chocolate shop in Paris because everything, right? It should be, that would still be cool.
Is this an either or?
Haven't paid off medical school yet. No, I found myself feeling like a hypocrite as an educator because I was training the next generation of primary care doctors to Band-Aid a gaping wound. And we were not actually delivering medical care that met our patients' needs and got to the root. And we were trying so hard. It's not for lack of trying, but the system is so broken. We were not able to give our patients what they needed, and we weren't getting what we needed as mostly altruistic people who deeply desire to help. And so culinary medicine brought me back to actually delivering something that I felt made a difference. And the medical students show up and they say, this is the best thing we've learned in all of medical school. And they show up over and over and over again because they see that there's something empowering about what we're doing with our patients instead of this paternalistic or maternalistic, here, take these meds. And I prescribe meds. Mm-hmm. I'm not here to say that it's a yes and conversation. It's not either or, but we're able to offer a new tool that transforms the health of our patients, and that transforms the health of everyone delivering care. So we understand one another, we listen to each other. You cannot break bread with someone and not grow and change and understand their story. So I think it heals a generation of burned out clinicians and health professionals. It's unbelievably powerful at that.
100%. So when I started my career, I was really in a fortunate place. I had received culinary medicine as a core part of my dietetics training. So I'm so appreciative that there are programs that are considering, we understand as dietitians why, the kitchen work just wasn't valued. Some of that work and that labor is not valued. And to be real scientists, we had to step out of the kitchen, step away from that work. But we want to encourage people, keep that evidence-based hat on and step back in, because that's where a lot of the real intervention can happen. So when I began my career, I was really fortunate. I was in an oncology center, and 25% of what I was doing was very traditional medical nutrition therapy in an outpatient setting for cancer patients. And I do want to reiterate to all of those that may not be convinced, we are not saying that culinary medicine replaces traditional medicine, replaces traditional medical nutrition therapy with our dietitians. That's my area of expertise. This is a great tool for you to use with your clinical context to offer a solution for those patients who need that skill intervention, who need that brand that culinary medicine can bring. So I had this 25% of a culinary medicine outpatient practice, and then I had 75%. And learning how to leverage going from the clinic into the kitchen and back and forth when it was appropriate was an incredible skill that I would love every clinician to have. If a colleague said to me, you know what I'm thinking about? Culinary medicine. First thing I would say would be, yeah, yes, we love that. Okay, I would say the thing I love about the teaching kitchen work, if you look at what's going on around the globe, with all of these people who are excited, they're looking for a cure for burnout, they're looking to connect with their patients and get them the tools that they so desperately need. I would say, the beauty is that you can enter the system with whatever resources you have. I do recommend, I believe that when we're talking about food as medicine, whatever the moniker is, you want to use that with culinary medicine being a part of that model. We really need to focus on how are we as clinicians, how are we getting folks into that kitchen? So connecting with you have a need. So if you have a clinic and you're saying, hey, I'm talking to my clinicians, if you're not a part of that clinic, we're just seeing some skills that are missing, we're not connecting the dots. How can we connect those two? Let's look for the adapter space between traditional clinical models and the teaching kitchen so we can leverage the teaching kitchen as an intervention model and really measure the outcome. You want to think about, you're doing that work. How do you know you're successful? How do you know you're successful in the kitchen? So make sure you're connecting with all of the great work about how to measure what you're doing, because we want to celebrate what you're doing in the teaching kitchen to help institute real change.
Colleagues come to me all the time and say, how do I do what you're doing? I need out of the rat race of the medicine I'm providing that doesn't satisfy my patients anyway. And they're in every specialty. Emergency medicine physicians are coming to me in record numbers asking how they can somehow do this. We've got people in gastroenterology, people in oncology. They're coming to me asking how to make this part of their practice. And I tell them, unlike the way we're trained scientifically and medically, where everything has to be a decade of training and preparation and it has to be perfect before you're ready to roll out, you can just start. Just go to the conference, get the experience, get in the kitchen, learn and shadow other people who have culinary medicine training, and then you don't have to make this your whole job next week. You start, you build a small piece of this, and then it grows. And then maybe you'll be like us and you want it to be your whole life because you can't imagine having more joy in your work. But it can start anywhere. It can start small. We teach culinary medicine in church kitchens, in YMCAs, in food pantries. You don't have to have a beautiful, massive teaching kitchen to do this work in an impactful, powerful way. I'm bad at having favorites. I love food. I love all food. Okay, if I were stranded on a desert island,
Raise the stakes.
smoked paprika.
That's due to Tim Harlan, by the way.
Yeah.
Okay, so ideally I would have my avocado toast with smoked paprika and I would have my chia seed pudding with raspberries over here. Can't pick just one. That's what I need. Simple food. I don't have to have fancy food. Beautiful, fresh ingredients, seeds, whole grains, fruits and veg.
I'm going to tell you what I'm excited about right now. This actually is one of the OG culinary medicine recipes, and it surprises people, the English muffin pizza. Mm-hmm. And the reason why I like it is, even as somebody with a lot of culinary education, we have to get real with ourselves and say, sometimes we need a low brain effort way to repurpose leftovers, repurpose ingredients, reduce food waste. So the English muffin pizza, it's small, it's tasty. Check it out. They did not tell me to endorse a culinary medicine. I get no compensation from endorsing that. But the English muffin pizza, it's simple, it's accessible. And
the residents love it.
The residents love it. Our food pantry recipients love it. It works if you're, I'm a dietitian. I'm not in it for the money.